President Trump just launched a discounted drug website for seniors that is going to be called Trump RX. It's going to save seniors as much as 85% on specific drugs that up until now have been very expensive and has caused seniors a lot of frustration because of the high cost of those specific drugs. The president met with drug companies, negotiated these reduced prices, and made the announcement himself. There are a list of drugs that are eligible right away, and then more are going to be added later to the Trump RX website. I am going to bring you the details, who is eligible, and how you can take advantage of these discounted prices. My name is Kwame Kwade. I am a government benefits expert. For 15 years, I've been helping seniors get the retirement benefit they deserve. I create content on Social Security, Medicare, Medicaid, food stamps, and other personal finance topics that affect seniors both in and out of Congress. If you're new here, welcome. I am glad you're here. Do me a quick favor, go into the comments and let me know your city and your state. Now, if you've been watching my channel for a while, welcome back. I am glad you're here. We have a lot to cover. So let's go to the New York Times article about Trump RX that explains things in detail, and then we can all read it together. So here is the article. It says how Trump's online drugstore may affect your drug cost. So this is a big deal because one of the things that has eaten at seniors' income over the years has been prescription drug costs. And if you have been paying attention, you know that America has one of the highest prescription drug costs in the developed world. And so one of the president's campaign promises was to drive down prescription drug prices. And so this is the first attempt at negotiating directly with the drug companies so that American seniors can get the same prices that these drug companies are selling the same drugs in other developed countries like Europe. And so let's read this article. It says President Trump and top health officials announced a deal with Pfizer to lower Medicaid prices and a website to help consumers buy drugs directly from manufacturers. That is the part I want to emphasize. The website that now allows consumers, seniors, to buy drugs directly from manufacturers. President Trump and top health officials heralded a drug pricing deal with Pfizer on Tuesday as a breakthrough that would save money for American patients struggling with prescription costs. Now, you're probably thinking, why would the president want to do this? What is behind this? Well, it is because prescription drugs have been a big problem. It's been one of the things that has eaten at seniors' income over the years. And so the president wanted to make sure that this is addressed. So, under the deal, Pfizer agreed to charge Medicaid prices that are about the same as those it charges in European countries. Trump officials also said that they will push manufacturers to set prices for newly introduced drugs at similar levels in the United States and other rich countries. And they said they were planning to create a website, trumprx.gov, that would help people buy prescription drugs directly from manufacturers like Pfizer. So essentially, what they're doing is that the president and his team is negotiating directly with these companies, and then they are passing on the savings to consumers. But the price equalization idea, Mr. Trump is tapping into a widespread frustration that drug prices are too high in the United States. The Biden administration also took steps to lower drug prices for patients and government, though it did not zero in, as Mr. Trump has, on the idea that drug prices are unfairly low in Europe. So basically, the president's negotiating tactics is essentially this. Why are drug companies selling the same drugs at a lower price in Europe and then selling it at a higher price in the United States? Even though these are US-based companies, US manufacturers, they produce the same drugs and then they sell it in other countries cheaper and then charge Americans the highest price for it. And so that is the negotiating tactics that the president went into this with. And that is how these companies were able to pretty much change their tactics on how they're treating American consumers. Now, if you want to stay on top of all of this, these kinds of content, you may want to join my community for seniors. I have created a new community. It's under skool.com/benefits insider, where I go deeper into these topics, among other things that I share. And it's a community for seniors to have access directly to me and also be able to ask me questions, and I can respond to you directly, but also be able to get all the resources that I've been creating, that I've been offering on this platform. Almost 200 people have already joined, and I think you should also consider it. So let's go deeper into this topic about prescription drugs. So how would the prices work? Mr. Trump's deal with Pfizer applied to only a tiny sliver of American drugs, drugs that Americans take, but it would establish a precedent for more medicines and other type of health insurance. If the plan was expanded, the most significant savings will accrue to American employers, private insurance, and government health programs like Medicare. That is why I wanted to cover this topic, because the biggest benefit to this program is really going to be Medicare, because Medicare bears a brunt of a lot of these costs that are crushing seniors. And so I think that something like this is going to benefit a lot of seniors who have been frustrated about prescription drugs eating up a lot of their income that they've worked so hard to earn. And so here's the deal. In some cases, the price equalization idea could also generate direct savings for American patients. Using insurance, some patients will pay a percentage of their drug sticker price, say 25%, in the form of co-insurance, or they have to pay the drug's full cost until they hit a certain maximum annual limit, for example, $2,000, which is also currently being done in Medicare. So you're probably thinking, what are these specific drugs that are covered under this program? Well, currently with Pfizer, the president has announced 4 drugs. The first one is a menopause symptoms drug, and it's 85% discount. It is called Duavi. The second one is eczema drug. Is going to be at $162, a significant discount, and the drug is called Eucrisa. The third one is an overactive bladder drug. It's going to cost $42, and it's called Tovias. And then the fourth one is an autoimmune condition drug at a significant discount, and it's called Xeljanz. So what does this mean? Well, Trump is pushing for the most favored nation pricing, which means the US matches the lowest price other developed countries pay. So essentially what the president is doing is that he's asking the drug companies to say, who are you selling the drug to the cheapest? Give us the same price you are giving that country. So that is, if it's in a developed country, who are you selling it? Are you selling it to Italy cheap? Are you selling it to the UK? Are you selling it to Switzerland? Are you selling it to Canada? Who are you selling this drug to the cheapest in the developed world? Give us the same price. That is the basis of the president's argument, which sounds reasonable to me. So Pfizer also agreed to invest $70 billion in the US research and manufacturing, and more pharmaceutical companies are expected to join this negotiation next week. This is part of Trump's campaign against higher drug prices. Now, there's some reality check here, so let's talk about it. While this is a noble effort, and I think it's a positive thing that is happening, there's also a bigger picture here. There are a lot of drugs that haven't been included in this, and so let's talk about that. And I think that that's where some background is important. While some discount took, this looks impressive, for many people, discount programs like Good RX or McCuban's Cost Plus drugs may still offer better value. The primary reason is that Trump's RX doesn't have a wide range of drugs at discounted prices. They only announced 4 drugs, and they're trying to add more. But when you look at other programs like Good RX or McCuban's, Entrepreneur McCuban has something called the Cost Plus drugs. And basically, they are giving you drugs at the cost, manufacturer's cost, plus a little bit of profit. So they are being very transparent with how they are doing things. But as a result, people, including seniors, are getting amazing discounts on prescription drugs because they are very transparent with their pricing policy. They tell you how much the drug costs to be produced, and then they tell you how much margin or how much profit they've added to it. And so that's what the name cost plus drugs come from. Now, so are you currently taking any of the drugs that President Trump has negotiated? Would an 85% discount on Duavi or 42% for Tovias change how much you access your prescriptions, or will you still prefer going through your insurance? Let me know in the comments how you feel about this negotiation. What other drugs you think the president needs to add to this particular um, this particular list, because obviously there are so many drugs out there that seniors depend on. Some are more popular than others, and so it will be helpful for you to also chime in and let the president know what are the other drugs that you would like to see prices come down dramatically so that it can help you save money. So I want to hear from you in the comments section below. Now, if you want to be updated, if you want to stay on top of all the news and updates that are happening with Social Security, Medicare, Medicaid, food stamps, and personal finance for seniors, then get on my text list. All you have to do to join is text Insider to the number you see on your screen, 443-293-0080. When you text Insider to this number, you join my Insider text list. And what happens is that as soon as there's a breaking news, I'm not only going to share with you, but I'm going to give you background on what it means and how that breaking news affects your retirement, your benefits, and your pocket. And so text Insider to 443-293-0080 and join my Insider text list. So that is what I wanted to cover with you today. I hope that it was valuable to you. If you found it helpful, hit the like button, hit the subscribe button, and I'm looking forward to seeing you tomorrow on another video.